and he's going to talk to us about managing complex cases of von Hippel-Lindau.
Okay. Dear judges, dear colleagues, von Hippel-Lindau disease is a congenital autosomal dominant multisystem disorder characterized by the presence of angiomas of different localizations. Few words about the history. In 1904, German ophthalmologist Johann von Hippel described 2 patients with this pathology, and in 1926, Swedish pathologist Arvid Wilhelm showed a relationship between retinal, visceral and central nervous system components of the disease, which he calls the central nervous system angiomatosis. From this time it was proposed to call this disease the Lindau disease, but in 1964 the medical community decided to pay tribute to German ophthalmologist and introduce today's concept. The supervision of this pathology is quite responsible task because it's relatively rare, very severe, and people of young age are exposed. There are difficulties in diagnosis and treatment. The pathogenesis of ophthalmic manifestation is as follows. The retinal angiomas that exist since birth increases in size, the caliber of the feeding vessels increases, it progresses, retinal detachment appears, the proliferation develops, and it can finish with death of the eye. The differential diagnosis is sometimes necessary with exudative retinitis, different intraocular neoplasms, hemorrhages, posterior uveitis, and parasitic lesions. The arsenal of medical events is quite large in light forms, but in the presence of retinal detachment and PVR, the vitreosurgical intervention is necessary. During it, we can strike on the angiomas more widely with above mentioned methods, but as also we can make ligation of feeding vessel, and the resection of angioma. Of course, we can take a biopsy, but these methods can lead to many troubles and difficulties. The purpose of this work is to estimate the results of intraoperative intraocular thermotherapy of angiomas during pars plana vitrectomy in the treatment of retinal detachment complicated by proliferative vitreoretinopathy in von Hippel-Lindau disease. We've got 5 patients with this pathology. All were carried out standard pars plana vitrectomy and thermotherapy of the nodes. The first clinical case, the patient came with complaints for lack of objective vision on the right eye. It's his anterior segment data. It is clean, but we could see signs of exudation in vitrum. But on the eye fundus, we could see full retinal detachment. In the lower part of it, we could see parietal subretinal red-orange formation and thickened crimped feeding vessel that came from the optic disc. The volume of surgical intervention was as follows: pars plana vitrectomy, introduction of perfluorocarbon, draining of subretinal fluid, and endothermotherapy of the node on these parameters. Then replacement of perfluorocarbon with silicone oil was performed. And this is the result: full retina adherence, lack of the node activity. We couldn't even see the feeding vessel, and quite high BCVA. Next clinical case, it's young patient, the same complaints, but for a very big period of time. It's his objective data. And on the eye fundus, we could see domes of detached retina. We couldn't even see the optic disc, but we could see a thickened crimped vessel came from it to the periphery, to extreme periphery, and there we could see the angiomous node. That's how his best scan looked like. The size of it is rather big. And the volume of surgical intervention was as in previous case, but in this case we used not only endothermotherapy but transcleral thermotherapy, because the volume of the node was very big and it was important to work with the whole volume of the node. And in this case we used gas tamponade of the eye. It's his eye fundus in 3 months after the surgery, and in 1 year after surgery we could see full retina adherence, the stabilized process, and the eye was saved. So in 4 cases out of 5 it was possible to adhere the retina and stabilize the process, but in one severe case it was the relapse of lower retinal detachment and growth of new nodes, and it ultimately led to amaurosis. But the second eye of this patient, he was managed to save his second eye because of timely performed transpupillar thermotherapy. Of course, vitreoretinal surgery is very effective method of treatment, but it's extreme method of treatment, and it's better to timely diagnosis and timely treat this patient correctly. If you use laser methods of impact, it's better to use thermotherapy because it's a deep puncture into the vessel structures. But if the patient nevertheless with a retinal surgery, you should use intraoperative endocular treatment because it has a number of advantages. At first, different cloudings in the cornea, in the lens, or in the vitreous don't interfere with the radiation. In the second, we can drain the subretinal fluid and introduce the perfluorocarbon to adjacent the retina and work on the adjacent retina. And in the third, we have much greater range of action, and we can work on extreme periphery and in the dentin line if it's necessary. Conclusion, the treatment of von Hippel-Lindau angiomatosis complicated by PVR and retinal detachment with postplanar vitrectomy and angiomas, and the thermotherapy is an effective method in severe forms. And for most cases, it leads to restoration of objective vision. But early detection and treatment of the light forms of the disease is necessary for maintaining high visual functions and high quality of life. Thank you.